The 20th of August, 1947, Nuremberg, Germany. Inside a courtroom thick with silence, judges take their seats as 23 defendants stand to hear their sentences. For more than 8 months, this tribunal has examined crimes committed in the name of medicine. Known as the Doctors Trial, it has exposed how physicians serving the Nazi regime abandoned their oath and used their training to harm rather than heal. Witnesses testify about the Nazi euthanasia program, in which mentally ill and physically disabled patients are classified by the state as unworthy of life and systematically murdered. Others testify to brutal medical experiments carried out on prisoners in concentration camps without consent, experiments that inflict extreme pain, permanent injury, and death. These crimes are not the actions of a few individuals, but part of an organized system sanctioned by senior Nazi leadership and carried out under the authority of Heinrich Himmler, head of the SS. As sentences are read, the illusion of scientific purpose collapses. What remains is the record of doctors who chose loyalty to a criminal regime over humanity. Among the defendants stands a German surgeon whose hands operated not to save lives, but to destroy them. His name is Fritz Fischer. Fritz Ernst Fischer was born on the 5th of October 1912 in Berlin, then part of the German Empire. On the 30th of January 1933, Adolf Hitler and his Nazi party came to power. In February 1934, the 21-year-old Fischer joined the Nazi paramilitary organization, the SS, eventually reaching the rank of SS Sturmbannführer, equivalent to a major in the US Army. In May 1937, Fischer became a member of the Nazi Party. After receiving his medical license in January 1938, he completed his doctorate in July of the same year at the University of Hamburg. Later in life, he got married and had 3 children. The Second World War started on the 1st of September 1939 when Germany invaded Poland. 2 months later, Fischer was inducted into the Waffen-SS, the military wing of the SS. After serving as troop physician with the SS division Leibstandarte Adolf Hitler, he was wounded on the Eastern Front and transferred to the SS hospital at Hohenlichen, a medical complex in northeastern Germany. There, he began working under Professor Karl Gebhardt, chief physician at the facility, and soon began assisting him at the nearby Ravensbrück concentration camp. It was there that Fischer became directly involved in a series of surgical experiments carried out on female prisoners. The victims were primarily young Polish resistance fighters who had been transferred to Ravensbrück after receiving death sentences in German-occupied Poland. In the camp, they became known as the rabbits because they felt used like experimental laboratory animals, and because the experiments made them unable to walk, they could only hop. Many were in their 20s and had arrived in good physical condition. Their strength and general health made them suitable subjects for invasive procedures designed to test how bone, muscle, and nerve tissue responded to severe, deliberately inflicted injury. In several of these operations, a hammer was used to fracture the lower leg bones before surgical treatment continued. The open wounds were then deliberately contaminated with aggressive bacteria in order to provoke infection, and the progression of these injuries was carefully observed as the prisoners were subjected to different forms of treatment. One of the female prisoners selected for these experiments was Aniela Sobolewska. In late summer 1942, she was taken from her barracks to the infirmary. Surgeons cut open both of her lower legs and deliberately fractured the bones. The broken shin bone was repositioned, and her legs were immobilized in plaster casts that extended to the groin. The stated aim was to observe how bone tissue regenerated after extreme trauma, yet the trauma had been inflicted solely for experimental purposes. Other women underwent similar procedures. Rectangular sections of bone were cut from the shin and later removed entirely along with the surrounding tissue. Surgeons documented the destruction and monitored where the bone regeneration occurred. Portions of muscle were excised to measure tissue recovery, and nerve strands were severed in order to study the effects of partial paralysis. These operations left many of the women unable to walk normally and caused permanent disability. Another female prisoner, Zofia Stefaniak, had both her legs operated on and remained confined to the infirmary for months. She later testified that she had not been informed of the nature of the surgery and only understood its purpose after enduring lasting damage. She recalled, "They cut deep into my legs, and when the bandages were removed, I knew I would never be the same." Another Polish survivor of these experiments, Leonarda Bień, endured repeated operations over several months, during which large portions of bone were removed from both her shins and calves. Each procedure weakened her further and increased the structural damage to her legs. After the war, she described the agony as constant and unrelenting. She said, "Every step was like walking on broken glass." The experiments extended beyond fractures and bone removal. Surgeons deliberately damaged nerves and excised muscle tissue in the legs to determine whether these structures would regenerate. In some cases, they explored the possibility of transplanting entire limb components from one person to another, believing such procedures might later assist in treating amputee soldiers of the German army. During his trial testimony, Fischer described how he removed a prisoner's arm, including the scapula, wrapped it in a clean sheet, and transported it back to the SS hospital in Hohenlichen. There, it was handed to Professor Gebhardt, who surgically attached it to a German patient. The procedure was presented as a medical achievement, though it had been made possible only through the mutilation of a prisoner. Several of these operations were performed with little or no effective anesthesia. Survivors later recalled being conscious during parts of the procedures and feeling the pressure and cutting as surgeons worked on bone and tissue. Fischer assisted in these procedures from beginning to end. He handled instruments, exposed bone and muscle, and closed wounds that had never required surgery. The operations were recorded and evaluated as scientific work, even though they had been carried out on prisoners who had no ability to refuse and no possibility of escape. The bone and nerve operations were only one part of the medical crimes carried out at Ravensbrück. Beginning in the summer of 1942, Karl Gebhardt initiated another series of experiments, this time focused on the treatment of infected wounds with sulfonamide drugs. Fritz Fischer assisted in these procedures, working closely with Gebhardt and Dr. Hertha Oberhäuser inside the camp infirmary. The official justification for these experiments was the treatment of battlefield injuries. German military doctors had debated whether sulfonamides were effective against severe wound infections, particularly gas gangrene. Gebhardt sought to prove his own views by creating controlled infections in living prisoners and then observing the results. Groups of Polish women were selected from the camp population, many of them the same resistance fighters who had already endured earlier operations. They were brought into the infirmary under guard and placed on operating tables. Surgeons cut deep incisions into their lower legs, often several centimeters long and more than a centimeter deep. The wounds were deliberately contaminated with mixtures of bacteria, including streptococci, and organisms associated with gas gangrene. In some cases, foreign substances such as wood splinters or ground material were introduced into the wounds to simulate battlefield contamination. The incisions were then partially closed and immobilized in plaster casts. Some women received sulfonamide powder or injections. Others were left untreated in order to create a comparison group. The results were brutal and immediate. The infected wounds began to swell and darken as pus accumulated beneath the skin. High fevers developed, often reaching life-threatening levels. The women suffered intense pain, vomiting, and weakness. In severe cases, tissue necrosis spread along the leg, producing the characteristic odor of gangrene. A female prisoner, Wanda Pultawska, later testified that the pain was overwhelming and that the swelling caused her skin to feel as if it would burst. Several of the women died as a direct result of infection. Others survived, but carried deep scars, muscle loss, and chronic disability for the rest of their lives. Some required repeated surgical interventions to remove infected tissue, further increasing their suffering. Fischer assisted Gebhardt during these operations, preparing instruments, managing the wounds, and participating in follow-up procedures when infections worsened. The experiments were documented in detail and later presented as scientific evidence regarding the effectiveness of sulfonamide therapy. Yet the conditions under which the wounds had been created bore no resemblance to genuine medical care. In May 1943, Fischer left the concentration camp and went to the front. In August 1944, he was wounded and, as with his concentration camp victims, had his right arm amputated. After the war, the unethical and inhumane medical experiments which Fritz Fischer had conducted were uncovered, and he finally faced justice for his crimes. He was arrested and tried at the Nuremberg Doctors Trial, where he was one of the few accused doctors who showed signs of remorse over his actions and openly talked about how he felt badly for operating on healthy young women. To defend himself, he claimed that the order to conduct medical experiments on human beings had come from Adolf Hitler himself via Heinrich Himmler, and that it was his duty to simply obey and do what he was told. He also claimed that his participation was solely that of an assistant, and it was not his function to analyze the legal situation. When he was asked if it was permissible to experiment on persons condemned to death without their consent, he replied that he had acted at that time as the soldier Fischer, not as a doctor and a person. He compared his situation to the one in which the individual soldier fires a torpedo against a ship, or when another soldier is under orders to drop bombs on an unprotected city. Fischer believed that they all had to overcome their innermost objections and felt themselves to be justified in what they were doing through the fact that they were acting under military orders, contributing to the victory of their own people and nation. On the 20th of August, 1947, the U.S. military tribunal found Fritz Fischer guilty of war crimes, crimes against humanity, and membership in a criminal organization, the SS, and sentenced him to life imprisonment.
Fritz Fischer, Military Tribunal 1 has found and adjudged you guilty of war crimes, crimes against humanity, and membership in an organization declared criminal by the judgment of the International Military Tribunal as charged under the indictment heretofore filed against you. For your said crimes, on which you have been and now stand convicted, Military Tribunal 1 sentences you, Fritz Fischer, to imprisonment for the full term and period of your natural life, to be served at such prison or prisons or other appropriate place of confinement as shall be determined by competent authority.
However, His life sentence lasted only a few years. In 1952, his sentence was reduced to 15 years, and in 1954, Fischer was released for good behavior. Although the German authorities restored his license to practice medicine, unlike Hertha Oberhäuser, his fellow colleague from Ravensbrück concentration camp, Fritz Fischer never returned to the profession of a doctor. Instead, he started a new career at the chemical company in the German town of Ingelheim, where he stayed until his retirement in 1978. When Fritz Fischer died in 2003 in Ingelheim at the age of 90 or 91, he was the last known surviving defendant from the Doctors Trial.
Thanks for watching the World History Channel. Be sure to like and subscribe, and click the bell notification icon so you don't miss our next episodes. We thank you, and we'll see you next time on the channel.